I wanted to point out we're going to be talking a little bit about medicine in this half hour. Russell Singleton is joining us from Tripp Family Medicine right here in Twin Falls. And also, he's available to take some of your telephone calls this morning. You've got a medical issue and the like, but he's going to be talking too about medical professions. If you're a young person out there, and it can be very enjoyable work, and you get to work with people. In other words, it's a call to service. I think is that a good way to put that?
I think it is. I think most of us, when we are preparing to go into health professions, have that as a major goal that we want to help people. Sometimes those desires change a little bit as we go through training and we realize how much debt we're going to be in and we realize the lifestyle that we're having to live. But absolutely, at the core, I think we all want to help people. That's why we do it, and that's what keeps us going despite some of the difficulties in this changing landscape.
Now, the old comedians used to joke when I was a kid growing up that, for instance, doctors played golf on Wednesday, which is why you couldn't see them, and drove big fancy cars. And then I got to know a few people in the medical professions, and as it turns out, it isn't quite unless you're a well-known specialist working as a doing surgery for the stars, cosmetic surgery. It's not necessarily that type of work.
Yeah, I work 5 days a week. My car is a used 15-year-old Hyundai, and I've never played a round of golf in my life. So if that gives anyone an idea of what it's like inside the medical profession, there you go.
Now, for people who are looking around and thinking, "This is what I'd like to do with my life," is it competitive to try to get a job in the medical field?
Well, that's kind of what I wanted to talk about today. I teach an undergraduate class in communicable and non-communicable disease, and a lot of our students are pre-professional. So they're getting ready to go to medical school, to PA school, to nursing school, to dental hygiene, to physical therapy, whatever um, it is. And we always have to spend a good deal of time talking about what a PA is like because having having that experience myself and it being consistently one of the top ranked professions in the country by Money Magazine, Forbes, there's a lot of interest in it. And so competition is quite high. I did my graduate work at Idaho State University. There were 60 seats at the time, and I think that year received 500 or 600 applications or even more. So uh, a fraction interviewed, and even less than that were actually admitted. And there were programs that were actually even more competitive. Uh, well over 1,000 applications for 30 seats or for 60 seats. So yeah, very much so.
And once you get through this, I'm sure that the program is. I had a friend who was telling me about a girlfriend who went to. I'll get to that in a moment. We'll take a telephone call first, but I have a comment I want to add about the intellectual challenges that some of this will post. But first of all, caller, you're on the air at 8:37. Go ahead.
Yeah. Do you find that there is some offices that demand for you to see like 25, 30 patients at one day? Or because I've seen that happen before, that they, like in Arizona and Colorado, that's what they do is like the big old clinics that take care of, like, for example, like the kids that cross the border and stuff. They get PA services too there, and they gotta see a whole bunch of people. Do you find that to be the status here also? Thanks.
Yeah, that's a great question. And I think the caller has recognized something quite obvious. And
Assembly line.
yeah, yeah, that is exactly right. And unfortunately, a lot of clinics or hospitals are like that, some by choice, some by necessity. You and I were talking off the air about how we are having to practice medicine under an ever increasing amount of regulation. Insurance companies and the government are constantly threatening to lower reimbursement. So what do offices do? Well, they try and maintain status quo, so they have to fit in more patients. And I don't like that as a provider. I think 20, 25, 30, 35, that's way too much. I've only got 8 hours, and 15 minutes a visit is already too little. So yeah, I think we do see that here. I think that's a bigger part of maybe um, larger medical institutions in this area. But as a small business, as an independent practice, family owned, we get to decide what we do. And yeah, we still have the same financial pressures that other people have, but I have appreciated working for the Trips because they call the shots. And if they decide we want to have 30-minute appointments, which we often do, then that's what we get. And the patient actually gets a fair amount of time with the doctor or the PA. So that's a great question. I appreciate that call.
And we've got to take a short break. We've got more ahead. I was going to mention I had a friend who's when I was in college, his girlfriend was in law school, and she referred to it as intellectual boot camp. And I would think that that's probably comparable too to some of the other professions that people enter. We'll get to that in just a moment. It's 20 minutes away from 9 o'clock. Bill Colley with you on Top Story on News Radio 1310, KLIX, and NewsRadio1310.com. We're at 44. Joined in studio by Russell Singleton. He's a physician assistant from Tripp Family Medicine right here in Twin Falls, Idaho. We're joined in the studio by Russell Singleton. He's a physician assistant from Tripp Family Medicine here in Twin Falls. Bill Colley with you as well. It's better health with Tripp Family Medicine. Great slogan, life's too short not to feel good. Quick question, in fact, if people would like to get in touch with the office, how do they go about doing that?
Give us a call, 933-4400. I am the only one not on spring break this week, so I'm holding down the office alone, but I bet we could still get you in if you call early. So talk to Ashley or Heather or Emma, and we can work you in.
We were talking just before the break about the rigors of an education, a medical education. And I was telling you during the break that I backed off after year of graduate school pursuing any sort of really serious additional. It was the old joke about PhDs piled high deep.
Yeah.
Um, I backed off of that because I had just reached a point in life where I thought I didn't want to be in school all of the time. And yet, I think that a lot of people out there, they have an aptitude for that intellectual rigor. But still, it's very demanding.
Yeah, and to address that aptitude, that's why we have things like the MCAT, the medical college admission test. We have the GRE, the graduate record exam, to try and determine whether or not a student, even coming out of a university program, has the ability to handle a high volume, high credit, high intensity type of program. And a lot of people don't. I mean, there were people that failed out of my PA school class or that were dismissed from the program because they couldn't keep up. So it really is important. But I guess I would say, as we start to maybe tease out some of the differences between being a PA and being a physician, for example, I thought about schooling and the amount of time it would take. I thought about the time it would take in a residency. I thought about the difference in the student loan debt I would have, and so and flexibility and other things. And so ultimately, I chose to become a PA. And most people who go into PA school chose PA school. I don't know of a single PA that went to PA school as an alternative because they couldn't get into medical school. In fact, I think some PA students are not only as capable but more so than medical students, because traditionally PA students are older. Your medical students are 21 or 22. They graduate high school, they finish their 4-year program, and they go into medical school. PA students are more like 25, 30, 35. They're oftentimes second career people, second healthcare career people. But in any case, I thought about all these things, the time investment, the debt, and and I chose to be a PA. But if being a physician is what you want to be, then do it. Invest the time, invest the money, because it'll be worth it. But I think you have to know without a doubt that being a physician is what you want to do. I think you have to know without a doubt that healthcare is what you want to do, because healthcare, a lot like other professions, law enforcement, um, firefighting, for example, these are lifestyles. They're not typical 9 to 5 jobs where you can punch out and then do whatever else you want. They're lifestyles. So be sure of what you want to do, and then do it. Be dedicated. Give it your best, and you'll be okay.
When I was a kid growing up, you had doctors, it seemed RNs and LPNs, and then now we have a system in place where you've got paramedics and EMTs, you've got the LPNs, RNs, you've got nurse practitioners, you've got PAs, you've got the physicians and the surgeons. We've expanded at least some of the definitions, haven't we, over the last 30 to 35 years, and at least created more opportunity?
Oh, absolutely. Even though the PA profession is probably 40 something years old, I think the first class graduated from Duke in 1969 or 68, maybe 70. I still meet people who don't know what a PA is, and every once in a while I'll have someone ask, "So when are you going to finish and become a doctor?" And I have to explain to them, "Well, I very consciously chose not to become a doctor, so I'm done. I was done years ago, and I think that's a good thing." Because I don't think you need 8 years of higher education and a quarter million in debt to diagnose strep throat. I don't think you need that to diagnose a urinary tract infection. And I also don't want to insinuate that PAs only handle minor routine cases because I have very complicated internal medicine patients who have diabetes, heart disease, hypertension, and other things, and we're trained to handle that. But I think in this country, we spend a lot of time and a lot of money on some things that just don't matter. I mean, look at physicians from around the world. They're basically bachelor's programs. They're trained in more of a vocational manner as a youth, and then they go straight into their medical education. They don't spend tens and sometimes hundreds of thousands of dollars on basic education. Now that I'm not saying liberal arts and humanities and all these things are bad because we want well-rounded, intelligent practitioners, but are we adding perhaps to the cost of healthcare? Are we creating barriers in a system that already is suffering a physician shortage? I think so, and I think PAs are part of that solution because of the rate at which we can train.
When I was a little boy growing up, and I'm going to make an analogy here, Father Megan, who was the Roman Catholic priest who was around the corner, he had a couple of associates, and today that same old church in my hometown, they have a like a circuit priest who comes through, and he handles several different churches. And over the years, they had more and more lay people get involved, more deacons and other folks, because there were changes, demographic changes, fewer priests, so they had to. There was a divestment, if you will, of some of the old roles that used to happen in medicine. And without asking you to be political, because this week there's a big issue going on Capitol Hill about medical issues. But in medicine, all of the changes that have occurred over the last 50 years in this country have also created somewhat of a divestment of those responsibilities as well, which is why you have all of these new titles that didn't exist probably when I was a little boy.
Well, I think to address that question, this might not be a direct answer, but I think that over the last generation or so, we've seen some wonderful changes. We've seen some capable professionals who are trained to practice healthcare, to increase access to care, to decrease wait times, to improve cost, that kind of thing. But I also strongly feel that a lot of the changes have been so bureaucratic in nature that a lot of physicians, especially, and maybe even PAs and nurses, are steering their children away from healthcare because it's not what it used to be. The regulations, the the negotiations, the lack of autonomy that providers now have that has been given away
As our
to
caller pointed out,
yeah, yeah, exactly, absolutely. And I don't know how we change that. I think personally we need to restore the autonomy of the patient. Now I know you could probably argue that it's difficult for a sick patient to really have that autonomy, and there has to be systems in place to help take care of them. But ultimately, I think decisions ought to be made between the physician or the PA and the patient. We've gotten so far away from that that medicine is starting to really lose some of its luster. And I'm not trying to generate sympathy because I still enjoy what I do and I think it's still a good choice. But we're making some interesting changes in this country, and ultimately, I think we're taking responsibility and authority away from you, the patient, and I think that is wrong. So whatever we do, I hope that we put the patient back in charge.
if we have somebody who's tuning in today, and let's say they have a son or daughter who's 15 years old and is thinking about a career in medical professions, What should they be taking for coursework in high school, at least as a preparatory?
That is a great question. And again, I'm going to answer that a little bit differently because I think you'll be prepared academically when the time comes. But if you're young, if you're a teenager, or even a young adult, I think what you really need is exposure. I think you really need to decide if this is the world you want to live in. I think you need to shadow different professions. I think you need to find a nurse, a doctor, a PA, a surgeon, a physical therapist, whatever in your neighborhood, and go spend some time with them. Ask them if you can just follow them around. We have high school students, we have pre-professional students, we have med students, PA students come train with us and follow us around all the time. And I think some of them realize that, whoa, this is not what I thought it was. This isn't anything like Grey's Anatomy. So maybe I need to rethink this. So again, academics I think will come, but get some exposure to the field because you may decide that this isn't what you want to do for the rest of your life.
I had a friend who, when she was at nursing school, I remember her telling me about taking an English course. And I said, "Why do you have to take an English course at nursing school?" And she said, "Because we have to do a lot of writing."
Oh wow. I just I that's that brings up some sore spots. I spend half my day in front of a computer and probably more, probably 60%. And it's not by choice. It's because we have to document, and that's reasonable. That is a good thing. I want people who come behind me to know what I did, why I did it, and what the results were of that intervention. But a lot of that time is spent clicking this box so we get credit for this program, clicking that box so we don't get dinged on that program, making sure that this result is here and that result is there. And it is incredibly frustrating. I mean, you would think that the push to be on an electronic medical record over the last couple of years has been a good thing. It has been terrible. We have practitioners that are down 20, 30, 40% in their capacity because they're wasting so much time on the computer. We have new regulations there. The government has more ways to check up on us to make sure we're doing what they think we ought to do. And it has taken time away from patients. So now we have to see 30 people in half the time.
Well, and when the caller referencing some of the corporate drive that goes on here, I had an eye exam and just in the last few days, and I got everything set for my new glasses. And then I thought, I'd ask about contact lenses because I've off and on had disposable lenses for years. Now, some doctors tell me they would prefer that I not wear them, but they're not illegal and it's really my choice. And I don't always want to walk around looking like a geek. Um, and as soon as I brought up contact lenses, I was pushed by the fellow fitting my glasses in the direction of, well, we could get you prescription sunglasses instead. And we've got a special right now. If you buy those after your exam, you'll get the frame half off. And I almost thought that's the corporate speak because they want me to go along with that special instead of trying to talk me out of something I just asked for.
Oh yeah, upselling exists even in medicine. And I hate to say that. I would like to say that isn't any part of what I do, but yeah, it's there, and sometimes it's purely profit driven for one reason or another. Sometimes it is to meet these regulations that are put upon us. But I have always believed that the patient is the ultimate authority. If I notice that you're a smoker, I'm going to ask you if you're ready to quit and if you want to talk about it. If you say no, we're done. We're done. I'm not gonna force your arm. I'm gonna recommend that you get your flu shot. I'm gonna recommend that you get your pneumonia shot. But if you say no, we're done. And perhaps I need to be a little bit more persuasive and more insistent. But I believe that the patient is the ultimate authority and that they should direct healthcare. And so I'm not going to try and force anything upon them. I'm not going to try and persuade them to do anything. I may recommend what I think is best practice, but ultimately, if they choose to do something that is against medical advice or that doesn't make me extra money, well, that's their right.
This morning, I heard, by the way, just want to throw this out there, that most millionaires, as a demographic, millionaires have the lowest percentage of smokers in the country.
Interesting.
And
Did not know that.
millionaires have the highest percentage of people who make their bed every day.
You know what? On that topic, I hate to kind of change the topic, but there's a great book called The Millionaire Next Door. Have you ever heard of that?
Yeah.
Wonderful book about what real blue collar millionaires are like. And just to go along with that, most millionaires um, drive a late model used car. Most millionaires, don't live in mansions. Most millionaires don't have a Rolex, new suits, etc. So interesting stuff.
And they do take care of their health,
Yeah, yeah, absolutely. And apparently they don't smoke.
and which is a good sign. We've got about a 30-second window here for people again who'd like to get in touch with the office. You're still looking for new patients.
Yeah, absolutely. We are growing and we haven't stopped growing, and we have contingency plans in case we keep growing because we want to provide patients an option. If you don't want to be part of the assembly line medical establishment, we want to be a viable alternative. So call us at 933-4400. We're on Facebook. We're on Twitter, hashtag Dr. Tripp, and www.trippvalleymedicine.com. We have a brand new website up, and I think patients will really like it.
I want to say thank you for coming by today, and we'll probably touch base with you soon. I know the rotation has been a little bit wacky
You'll see
lately,
me
but
next week, actually, yes.
next week. All right. We have a short break coming up. News is next from Fox. One more hour of top story ahead with Bill Colley on News Radio 1310 KLIX and newsradio1310.com.